Welcome back for the second half of Medoscopy, our look at the Women in Medicine program. In part one, we explored the nature of the program, how Mercy High School students take part in a 4-year endeavor, working with Mercy staff to gain insight into possible health-oriented careers. Once again, we are joined by Mercy High School students and Women in Medicine participants, Jacqueline O'Neill and Precious Najiri, as well as Mercy pediatrician, Dr. Julie Ellis. Thanks for joining us for part two.
Thank you.
So, how has this program influenced your opinions about healthcare?
I would say it's just reinforced my desire to go into the medical field because with every new experience, even if the department I was shadowing in wasn't necessarily what I was interested in, the staff was just so enthusiastic about what they were doing. And I knew that I could find something that I liked, and that ended up being surgery. And I'm just even more excited to follow in the footsteps of all the professionals I've met with.
Yeah, I feel like same to Jackie, like it definitely solidified my passion. Specifically like being here, like I said earlier, I just feel like it's like a positive environment. In a hospital setting, it can be like sad, heartbreaking because, you know, you're with patients who are going through a lot. But I feel like because here they're always maintaining such positive energy and they're just kind. Honestly, to put it short, they're kind. And I appreciate that, really, yeah. So I think that's definitely solidified that.
That's the Mercy spirit.
Yeah.
And that's why I still work here after 15 years.
Mm.
Cool.
So, also I'm interested in what advice, now that you've gone through the program, what advice would you give to other high school students, maybe some of your fellow classmates, about why they might want to check this out?
Yeah, I think the best piece of advice that I can give future women in medicine girls is to just have an open mind. Whatever you're going to do, you may end up loving it, you may end up not liking it, but you just have to have an open mind, especially when you're put in an area where you may not have chosen to go. It could be something you love. I know one of my friends, she's interested in veterinary medicine, but with each rotation, she's like, wait, I kind of like that. And she is like undecided now. So she's been introduced to so many new things, and all of us have.
Mm-hmm. Pursuing a career in medicine can be it can be a lot. It can be hard. And I know it's going to get a little harder as I go on, to college and then like medical school. But the advice I would give is to remember your why. Just remember why you're doing this, who you're doing it for. Yeah, just remember your why, honestly. Yeah.
Dr. Ellis, do you think it's important for institutions like Mercy to partner with schools like Mercy High School in endeavors of this sort?
Absolutely. I love that we are able to provide these young women, as well as many other young people, with mentorship opportunities and exposure to lots and lots of different areas of medicine. I would mimic what Jackie said about keeping an open mind. I never in a million years thought I'd be a pediatrician. If you asked me all through high school and college and medical school what I wanted to do, my plan was always to be the community doc in the middle of nowhere, move out west, Indian Health Corps, something like that, and be the only doc for miles around. And then I did a rotation in pediatrics and absolutely fell in love with it. I loved internal medicine, I loved OBGYN, I loved lots of different rotations, but pediatrics ended up being the perfect fit for me. So you never know what you're really going to fall in love with unless you experience it. I loved every minute in the operating room, and I never in a million years thought I would want to be a surgeon, but every minute in the operating room I found absolutely amazing. So you never know until you try what you might decide you really like. At the same time, it's also important to see things that are not really for you. That can help you narrow fields to decide what you'd like to do in the end. You also have to remember that there's medical school, there's nursing school, but there's also lots and lots of other careers in medicine, respiratory therapy, radiology, ultrasound techs, MRI techs, lots of different careers in medicine. So it doesn't necessarily, having a career in medicine doesn't necessarily have to mean college and medical school and residency. It can mean lots of different avenues.
Well, that's a good point, because I was going to ask whether you thought that the skills that you're learning are applicable to other areas beyond just possibly a career in health.
I think 100% they are. A big thing we learn is about compassionate care and seeing the patient as a person instead of just a patient or someone who needs fixing. So it's really given us a lot of skills in empathy and recognizing that when people are going through it, you have to be someone who's there to support them and help them.
Yeah, definitely. Just like a personal experience from my own. Like my dad, he's constantly telling me like blood circulation is like the foundation of medicine. And it's like, okay, Dad. But yeah, and I feel like everything's like kind of tied into that. Like I remember freshman year, I was very shocked actually. We learned about it, a little bit about it, and I was like really happy because I knew about it because my dad would teach me about it. But yeah, I think everything in medicine, despite what department you're in, they go together, like they tie together. So yeah.
I think some of the neat things that they've learned as well are actually skills that even if they decided to go into literature or teaching English or business are super important as life skills. So that compassion, seeing people as people, but also learning how to do CPR, being CPR certified. Stop the Bleed is a huge program that started through shock trauma for bystanders to be able to stop, to be able to help people in emergency situations, whether it's a car accident, a gunshot, a stab wound. But Stop the Bleed is incredibly important. And it's something we want to teach everyone, not just people who are interested in medicine. So I think that there's lots of things that they learned also that even if they decide, you know what, medicine's not for me, they'll still take with them into adulthood.
That's kind of also raises an interesting point. In the process of going through this program, is there anything that you encountered that you weren't a big fan of? Or that you wondered like, oh, maybe healthcare's got some elements to it that are a bit more challenging than I thought?
I would say that even though I enjoyed it, it was kind of a shock when I saw like hip and knee replacements, because those are just two of the most almost just invasive surgeries I've seen, especially the knee replacement. So it was just a shock to me how involved it is and how much care you have to put into after the surgeries, especially, and how you have to stay with your patient for such a long time just to make sure that they really are okay after all that trauma to the area.
For me, I feel like not necessarily. I mean, obviously I haven't gone to the internship yet. I've seen a lot though, but I think when I was in the pharmacy was great, but I guess I realized that it wasn't for me because it was more like computers and charting and all of this stuff, and I feel like I'd be more like with the patients, like in person, you know. But I guess that's something that I realized or I noticed about myself while I was shadowing.
Well, I think that speaks to the program, the fact that it's offering that kind of variety, because that way you can find out, what you like and maybe what doesn't work well for you. And that way you're more apt to gravitate to those things where you're going to be successful and happy. Because believe me, you want to find a career that you can be both in. It's not good to be successful and unhappy or happy and unsuccessful. You want to bring the two of those things together. Wouldn't you agree, Doctor?
Absolutely. And I'm lucky to have the best job in the world. I know you've both probably heard me say that before. But coming to work every day is never a struggle. I love coming to work because I get to care for our Mercy families and get to teach and mentor families, residents, med students, and lots of other learners.
Well, you're definitely on board. I can tell you really like doing this program. But you may have some colleagues who maybe are thinking about it, or maybe they're on the fence. How would you convince them that, yeah, you really ought to be part of this?
I think most of us who work here at Mercy, because it is a teaching hospital, are open to learners being part of our days. What I would say is that a lot of times I think my colleagues worry that it'll take time away from their already very busy schedules. But I find that the students really enhance the day rather than take time away. And I find that they're able to do little things like bring juice and graham crackers to my families in the emergency department, get stickers for our kiddos, be able to do those things that make them feel like they're a part of the medical team, and also save me a minute so then the time is that it's not taking time away from my day.
Well, it's clear the students are learning a lot. What do you think the physicians and staff that they're shadowing are learning?
It is incredibly important for every one of us to stay relevant and be exposed to the next generation. I think that it is wonderful to be able to have conversations with these amazing young women who are about to become adults. And I think it's amazing to get to have exposure to these young people who are going to be the leaders of tomorrow. For us to understand where they're coming from and get to know them a little bit more one-on-one helps us as older providers to be able to relate a little bit better to our younger patients.
Dr. Ellis mentioned about how some doctors may feel like, I'm just too busy to want to be involved. How do you two both feel about that concept of maybe getting in a career that might potentially take over your whole life? How do you feel about that?
Honestly, right now it's what I want most. I really want a career that I'm just completely in love with and that I want to spend all my time doing. There's definitely thoughts of like how I'm going to balance that with maybe a family and just lifestyle choices, but it just makes me excited because I'm really interested in everything I've seen so far.
I feel like for me, I love this setting 100%, but I would love some sort of outside life. Does that make sense?
Mm-hmm.
Like, I would love to love this job, and I know I will, considering I'm really passionate in what I want to go into, but balancing like a family, like Jackie said, and like other things, I think I would definitely want that.
Well, I can only tell you that I've been doing this program for about 4 years now, and I always ask the physicians, how do they manage that work-life balance? And they do. They do find a way to do it. And really the key is, setting up the boundaries in your own life about this is my time or this is my family's time and this is my doctor time or nurse time or whatever it may happen to be. But I think the thing that's most interesting is that a career in healthcare is really often more than a career, it's a calling. Would you feel that that's true? All of you? That's questions for all of you.
I think so, definitely. I've been so passionate about it since, like I said, I was in the 7th grade, and the passion just hasn't faded at all, and I really don't think it will.
For me personally, I think also it is a calling, that everyone has a calling to do something. Like, if you're good at medicine, I think it's your calling to do that. If you're good at engineering with computers and stuff like that, I think it's your calling to do that. I think everyone has a calling depending on, well, I personally believe depending on what God has given you the calling to pursue.
Well, for me, I talk to my residents and medical students all the time about this not being my job, but my vocation. I love that every day I get to come to work and care for our Baltimore families and help parents raise healthy kids. It's amazing. Going to medical school is a long haul. There's lots of other jobs out there that you can get to a point, a career point, much quicker and with much less education, much less student loans, if you decide that you're not truly passionate about medicine. So there's lots and lots of other careers out there. What's neat about this program is that it exposes kids at a younger age so then they can make those decisions earlier. But there's lots and lots of jobs out there that you can be passionate about that don't take nearly as much time and energy to get to the end point of if it's not truly your calling. And that's also fine.
And that's the whole reason that we're doing this. Mercy and Mercy are doing this, so you have an opportunity to see what this career is. It's not for the timid, let's put it that way, but it really can obviously make a huge difference, not only in your own lives, but in the lives of so many other people. Well, I want to thank you all for coming today. I'd love to be able to talk some more, but I'm afraid they only give us so much time here on Medoscopy. But hopefully those who watched learned a little something, maybe a thing or two that they can apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you.